Ladies and gentlemen, you're back for the Gousse Urology show. The purpose of this show is to educate you on various urologic disorders, on various medical conditions which can affect either you or a loved one, a friend, someone you know, or just general information that might be very interesting to you. My name is Dr. Angelo Gousse. I'm a board-certified urologist, professor of urology, and my specialty within the field of urology is sexual health and bladder health and reconstruction. Today, we're going to talk about ways to rehabilitate sexual dysfunction, both in the male and in the female, and we're going to talk about solutions. Now, obviously, sexual dysfunction on either male or the female can be a problem. It will affect many times the relationship. The relationship can be very stressed by sexual dysfunction on either side or on both sides. And it's not necessarily to talk about all the ramifications which can ensue from having sexual difficulties. When the bedroom is not happy, all the possibilities that can occur. Well, this is the problem. First is to recognize the problem, and we're here to offer potential solutions and talk about the risk and the benefits of the potential solutions which are currently available. We're talking about a problem which affects 40 million Americans and which affects approximately 50 million women in the United States. We're going to talk about how it's possible to rejuvenate the tissues of the vagina to a procedure called the O shot. It's called the O shot. It's called the orgasm shot. It was popularized by Dr. Runnels in Alabama, and I've had the opportunity of work with him, and for training purposes and other things we do, working together, and my training there as part of the Cellular Medicine Association, which is really an elite group of individuals who specialize in using special cells in the body to rejuvenate the body and to help the human body in a minimally invasive fashion. In the female, what happens is after menopause, or as women go through menopause, or even before menopause, not adequate blood flow goes through the clitoris. And the vaginal tissues, because of poor estrogen status, don't have adequate blood flow going to them. And many of these women, in addition to that, they have what is called urinary incontinence. Urinary incontinence means that they are leaking urine involuntarily, and there are more invasive procedures to address this problem, but now we have minimally invasive procedure that can not only help with the urinary incontinence with women, but also reestablish the health of the vaginal canal. Some women who've delivered very large babies, the vaginal canal can become very wide. So this is the tip of the vaginal canal, but it's possible to do reconstructive surgery, which we do in the operating room, to narrow the vaginal canal and make a vagina and introitus that is that big become that big. And often when we do that, we also repair what is called prolapse of the bladder, or prolapse of the rectum, or the organs. I happen to be double board certified. Not only I'm a board certified urologist, but I'm so board certified in female pelvic medicine and reconstructive surgery. So I do a lot of female reconstructive surgery, so we are able to rejuvenate, make the vagina narrow again, to increase the friction during sexual activity and improve sexual function. In terms of minimally invasive procedure we do, it's called the O shot. The way we do it in women is that we take a needle and we put the needle in the vein, and then we are able to draw blood, your whole blood. We draw your whole blood, and we take the whole blood. The whole blood has platelets, it has red blood cells, it has plasma and other growth factors in it. The only part that we're really not interested in to inject back into the female genitalia are the red cells. So we use a special centrifuge which separates the red cells from the plasma. So that centrifuge will centrifuge, let's say for 5 minutes, we centrifuge it in a special equipment, and then we separate them. We get the red cells out, which we don't need the red blood cells. We keep all the growth factors in solution. This is the solution of platelets, and the platelets are good for regrowth because they bring new growth in place, and it has growth factors in it. So we further centrifuge it and do a special extraction of the platelet-rich plasma. Platelet-rich plasma, PRP, is the same PRP, it's your own blood. We numb the vagina with a cream, all the vaginal tissue, and we inject it through the vaginal canal in the vaginal tissues. After we numb very well the vaginal tissues, and also the clitoris, which is analogous to the male penis, we inject the platelet-rich plasma in the clitoris. And once we inject the platelet-rich plasma in the clitoris, eventually within 1 month, 2 months, it will increase blood flow through the clitoris. So now when doing sexual activity, the clitoris of the female will be easily engorged and will have increased sensation, and that will improve their sexual function. In addition, the vaginal tissues will become more relaxed. They will become more pliable, and therefore sexual activity in the female will become more enjoyable. So this is what we can offer with the O shot, which stands for orgasm shot. It's a minimally invasive procedure. Other more invasive procedures, such as reconstructive surgeries that we can do to narrow the vaginal canal, fix the cystocele, which is the bladder prolapse, or the rectal prolapse, to improve sexual function in the female. We can also rehabilitate their hormonal status. Sometimes low-dose testosterone in the female can improve their libido, can improve a lot of their menopause symptoms, can improve a lot of their pain, a lot of their discomfort, a lot of their depression, a lot of their anxiety can be restored by hormonal manipulation of the female. Aging of the female, lack of quality of life in the female is often a hormonal imbalance, and this could be restored if you see the right clinicians who understand hormonal balance and can restore hormonal status in the female. So this is the information that I wanted you to have. We're going to talk about now about restoring sexual function in the male. Same thing, you can get the blood from the arm, you get the same platelet-rich plasma from the man. So, and then you extract the platelet-rich plasma the same way, and instead of injecting it in the clitoris that we do in the female, we injected it in the penis. We injected in the shaft of the penis, 4 injections after we numb the penis. You will not feel a thing after we numb the penis with the cream or with the anesthetic. 1 injection, 2 injections, 3, 4, 5 injections here in the glands. We inject it, your own blood. No complications, no side effects. You can't get an infection from it. You can't develop an allergy from it because it is your own blood being injected in your own penis. This is the platelet-rich plasma, the magic solution. It's effective 85% of the time, and it has a duration of about 2 years or so. You don't need to inject yourself. As I've shown before, every time you're going to have sex, when they give you those chemical agents called the trimix, every time you're going to have sex with the trimix, you have to before sex, you have to inject yourself. And often the trimix, you have to keep it in the refrigerator. So wherever you go, you have to find a way to refrigerate it. And it's a chemical that you inject, made of prostaglandin, papaverine, and pentolamine. So these are chemical agents that are injected that can increase blood flow in the penis and give you an injection. The P-shot is not a one-shot deal. Once you get the injection of P-shot, you don't need to inject yourself every single time you have sex. You're not injecting a chemical agent. You are rejuvenating your penis, making it younger. Another analogy, as if you're changing the oil in the motor of your car. So you didn't change the motor itself, but you make the motor more efficient because you change the oil. You rejuvenate the spongy tissue milieu, the spongy tissue environment in your penis. So it is a natural way of doing it. When that doesn't work, if that doesn't work, and that only occurs in about 15% of patients, 20%, it doesn't work for everybody. It depends on how damaged your tissues are. And it's impossible to know exactly how damaged your tissues are before we do the test, but most men will respond to it, and there are basically no side effects. We're going to talk about the penile implant. The penile implant is the ultimate solution for erectile dysfunction in the male. It is a synthetic material made out of silicone, which is implanted inside. Now, there are a lot of myths and realities of the inflatable penile prosthesis, and I want to take the time to talk about the myths and reality questions about the inflatable penile prosthesis. One of the myths, it's a very complex procedure. This is not true. In the experienced hands, high volume centers, which does a lot of penile implant, the complication rate is very low. I would say less than 4%, or even less than 2%. So the potential complications are very low in experienced hands. That's why you need to have this procedure done by someone, by a center that does many of it. This is one of our specialty procedures at Gousse Urology. We do a lot of penile implants because now it's being recognized more and more that patients, even some of them traveling from out of the country or out of the state, to have a penile implant with us. So, and the way it's done, it's about a 45-minute to 1-hour procedure. It's done under general anesthesia, and we implant the device. And I'm going to take a little break. I'll come back and explain to you how the inflatable penile prosthesis works and how it restores sexual function in up to 95% of men. So there's no solution, there's no problem that doesn't have a solution with the inflatable penile prosthesis. We'll take a break and we'll come back with Dr. Angelo Gousse, which we will talk about the inflatable penile prosthesis. We're back with Gousse Urology show, where we talk about important health issues. And we started talking about how to restore erectile function in the male after the pills don't work and the shots in the penis, if you choose that option, doesn't work. The vacuum erection device doesn't work. If even the platelet-rich plasma, which is likely to work, doesn't give you satisfaction, then there's always the solution of the inflatable penile prosthesis. The inflatable penile prosthesis is made out of silicone. It's like a balloon. It inflates the penis. Remember, we talked about the penile shaft. It's like a sponge. It's either you send blood in it to make it erect. If no blood goes into it, no matter what you do, then the only other solution to make it look natural, that you can inflate, become rigid, and deflate, is the inflatable penile prosthesis. The only solution that you have when everything else fails, you have to resort to the inflatable penile prosthesis if you're looking for a solution. Remember, Blood is what makes the spongy tissues erect. If no blood wants to get there, then you got to send saline in the spongy tissues. And what sends the saline, you have to dissect in the spongy tissues, which are in the penis, to a surgical intervention. Now, and insert these cylinders. These are called cylinders. There are 2 cylinders, one on the right and one on the left. So the cylinders in this position are deflated. They're floppy because there's no fluid in them. All the fluid is in the reservoir. So they are floppy. So in order for them to become rigid, there's a pump that is placed inside of the scrotum. Now, before I continue, I need to clarify something. Everything you're seeing on the television screen here, on this camera, is hidden. It's covered by skin. No one knows all this is inside of you. None of it is visible. In fact, many of my patients have an inflatable penile prosthesis, and their sexual partner doesn't even know they have it. You could walk naked in front of somebody. They will never know you have inside your body an inflatable penile prosthesis. That is how discreet this operation is. So I'm showing this only to go over the components of what's being implanted inside of you. The other way of looking at it, this is like a breast implant. When you look at a woman who has a breast implant, they undress, unless you know for sure, it doesn't show the silicone outside of their skin. It's under the skin. You see it's a nice looking breast, but you cannot know for sure if it's an implant, if they have their clothes on, or even if they're naked. It's the same way. You have the penile implant inside of you, but no one knows it's there. All these components, I'm showing them to you for educational purposes so you understand what it is. So we put the cylinders inside of you, and there's a pump close to your testicle which is implanted. By pressing on the pump, just like I'm doing here with my right hand, you could see that the penis is getting more rigid. It's getting more firm. It's getting more long. And this is what the inflatable penile prosthesis is all about. So then it gets rigid, so it allows you to have sexual intercourse for as many minutes, as many even hours as you want, as your partners accept. So even if you ejaculate, which by the way, if you were ejaculating before you had the penile implant, you will still continue to ejaculate. You have normal sensation. You feel as if it's your normal, natural penis. And you will ejaculate with orgasm the same way you were before. And your partner might not even know you have a penile implant. The only thing they're going to find out is a more rigid, larger, stronger penis that never fails you, and you're always ready. All you need to do is to press the pump. Whenever you press the pump, liquid will always come from the cylinders, from the reservoir into the cylinders. They will inflate the cylinders, which are in your penis. Your penis will get hard, it will get long, it will get wide, and you'll have good sexual performance every single time, as long as the device is working. And it works well in 96, 97% of the cases. So after you're done and you want to detumesce, meaning make the penis flaccid again, there's a little button, you press it, and then you squeeze on the penis a little bit, and then you will see within a minute that the penis is soft. That reservoir is only inside your body to hold the fluid, the saline, it's salt water, that goes to supply the cylinders, which get hard. And again, they get hard only if only you press on the pump. And this pump I'm pressing on right now is surgically placed under the skin of the scrotum close to the testicle. So you'll be able to feel where the pump is located, and you'll be able to press it, and you'll be able to generate a rigid, firm erection every single time. Now, there's a myth. The penile implant is not designed to make your penis longer. The same size you have is approximately the size the penile implant will be. Because when we place the penile implant, we measure the length of your penis, and we select a penile implant which corresponds to the size of your penis. It's individualized. Very similar, if you go buy shoes, they measure the size of your foot, of your feet, and then they fit you with the shoes of your size. If you're size 9, size 10, 11, depending on your size, you get the shoe that fits you. Similarly, in the operating room, we measure the length of your entire penis from the bone to the tip of the penis, and we find the right size for you. We have several sizes in our catalog. We select the right size. We place the right size for you, and you are able to achieve the rigidity which you're lacking every single time with normal sensation. Many of my patients are able to able to father children after the penile implant because they ejaculate normally and they restore their sexual function. And I could tell you, many of my patients are extremely satisfied. It's been a game changer. It has changed their life. The good news is most insurance will pay for the inflatable penile prosthesis. So you don't need to pay all of it cash, but unfortunately some patients do not have insurance. It's a very expensive procedure in the range of $22,000 because the penile implant itself is extremely expensive, that mechanical device. And when you add the cost of the hospital cost and the surgical cost, it adds up to approximately $22,000 to $24,000. But most insurance will cover a significant portion of this procedure. So if you have significant erectile dysfunction and you're tired of trying everything else, you might want to try, you might want to consider, you might want to talk to a urologist about the inflatable penile prosthesis. At least explore it and see if it's the right solution for you, if it's the right solution for your partner. You don't have to go through the rest of your life being completely devoid of sexual activity and live in shame and live with the depression and live with the sadness that you'll never be able to enjoy satisfied sexual activity again. It is possible to restore sexual function, both in the male and the female, almost always, every single time. There is a problem. There is a solution. When there is a problem in sexual dysfunction, there's always, almost always a solution for you. It is possible to perform a penile implant in diabetic patients, even in some heart patients, as long as you get clearance for surgical intervention. For the diabetic patients, it's important to control your sugar, your hemoglobin A1C, which is the blood test that measures glucose control in the diabetics. We don't want to put this implant in the diabetic patients that have hemoglobin A1C more than 10%, more than 9.5%. It's too high. We ask them to control their sugar better, and once they control their sugar better, we're able to implant it in them. If you have kidney disease, we're able to implant it. If you have hypertension, we're able to implant it. If you're paralyzed, we're able to implant it. If you have a stroke, as long as you have good manual dexterity to press the pump, or a partner who's willing to press the pump for you, we are able to inflate, we're able to place the implant for you. It's an outpatient procedure. You go home the same day. You don't need to be hospitalized. The recuperation is approximately 4 to 6 weeks. After the implant, you will be able to restore sexual activity. Approximately 8 weeks after the implant, you'll be able to restore and you're able to enjoy again sexual activity with your implant, giving you reliable erection every single time. So I do not offer the penile implant, the inflatable penile prosthesis, to patients until they have failed the less invasive approaches, such as the pills, Levitra, Cialis, or even the penile injections. And I always recommend the platelet-rich plasma before even the penile implant. Because after you get the platelet-rich plasma, the P-shot, it makes it easier for us to implant this. So even if the P-shot doesn't work 100% for you, and later you decide to place the penile implant, it makes it easier for the surgeon to implant it, because we are implanting it on healthier tissue. And every time you place the implant on healthier tissue, you get a better result with rigidity, with whiteness, with blood flow, and better healing and less chances of a complication. So I recommend to all of you, go to a clinician, go to a surgeon who is familiar in treating all the aspects of sexual dysfunction. And next time I will talk about the shock waves, which can also be used where you can shock the penis with like a shock machine that goes tuck, 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 that stimulates blood flow. And we have that also available in our office, the shock wave to the penis. We have the penile injections, the Trimix. We have the platelet-rich plasma. We have the vacuum erection device. We have the inflatable penile prosthesis. All the solutions that are available in the literature are available in our office at Gousse Urology. So I hope that was good information for you, treating the possibilities to treat both male and female sexual dysfunction. This is your urologist, your friend, Dr. Angelo Gousse. See you guys next time.
I'm Cindy. I'm studying to become an English teacher, and I love Island TV. Why? Because we are the Caribbean. We are Island TV. We need to reveal our fundamental contributions in America. We need Island TV to reveal our different beautiful Caribbean cultures for the world to respect and understand us better. Grow your business while supporting the only Caribbean television station in Florida. Advertise with Island TV.